Watch more programs like this on cable and stream with PCN Select. Subscribe at PCNTV.com.
Welcome to Coronavirus Impact. I'm Larry Casper. We have on the phone David Wenner, reporter for PennLive and the Patriot-News. Welcome to our program, David.
Thanks. Glad to be here.
Governor Wolf told all non-essential businesses to close in Pennsylvania. How are they responding to that order?
They seem to be, responding pretty well. And there were certainly a lot of questions about it. Exactly what is a non-essential business, which is actually pretty complicated when you start to think about it. But they've put out a lot of information regarding that, and it seems like there's pretty good compliance with it so far.
David, can you give us some examples of some non-essential businesses that we all seem to be agreed on?
Well, I think one of them one of the first that was mentioned as non-essential would be things like gyms and, yoga, places that do yoga classes. And then, of course, now the restaurants, aside from takeout and delivery, now the bars.
Are there any businesses, as far as you know, David, that are refusing to comply with the order?
You've heard some. I have heard some objections, but the strong message is that you don't want to create a situation where you might be contributing to the spread to somebody who is highly vulnerable. And that does seem to be a message that has a big impact on people when they stop to think about it. And, I've heard the concerns about young people going about their business as normal and, going out to bars and clubs and things. But now I was talking, I have two sons who are in their 20s. They live in Pittsburgh, and I mentioned that to one of them last evening, and he said the places like that are pretty much closed in Pittsburgh. He said that that's not going on in Pittsburgh, so that sounds like pretty decent compliance.
As far as you know, David, are there any consequences for not complying with the governor's order to close?
They're saying no. They're saying that they're not going to be using the Pennsylvania State Police and the National Guard. They're not going to be taking up their time and resources with that. And again, Governor Wolf has consistently said he trusts people to do the right thing, and that's the route they're taking. And just thinking about it myself. That seems like it could be a pretty complicated thing if they really had to, deploy state police to go around enforcing that, writing people up, whatever the process would be.
David, I understand the health department is prioritizing who gets tested for coronavirus. Just how is that working out? Well, as I'm sure you heard, there's a lot of concern that maybe people who a doctor feels should be tested, doesn't make the screening cut from the Department of Health. Over the weekend, go ahead. Let's talk about that, David, because you had reported that the test is for people who are very sick. That's out of your report. So just how sick is that? Be as precise as possible. Well, that would be someone who had those symptoms, which are very similar to the flu. So they are feeling really sick. They have a fever. They have a bad cough. They might have a bad sore throat, and I think most doctors are handling it is they try to make sure they don't have the regular flu or strep throat. But then so somebody who would be feeling those things and wouldn't have the strep throat or the flu, I mean, they would be candidates. They would be strong candidates to be tested. But as I'm sure you know, there has been a shortage of tests, especially mostly at the State Department of Health level, which has been the main testing source in Pennsylvania. And as of this weekend, they've pretty much been restricting it to not only people who are really sick, but people who work in a healthcare setting or work in a nursing home or have had some obvious direct way that could have caused them to become infected. Now, it also needs to be said, though, that other sources of testing are coming online now. The commercial labs and some of the hospital labs. But again, I think the big thing is you have to clearly have some possible symptoms before any doctor is going to refer you for testing or forward a sample to even a commercial lab.
And let's talk about these alternatives to government testing. For example, UPMC, I understand, has their own test. So if these other non-government entities are coming up with their own tests, do we have assurance that they're as effective?
Yeah, I don't think there's huge concerns about the effectiveness. I mean, I get the idea that it's not a hard thing for the typical lab, at least at an academic medical center.
It's not technologically challenging?
I get the idea that it's that it's not. They have the ability to come up with tests. But now there's normally a testing process, a government testing process, and they've really loosened that up. They're allowing them to go forward with their tests pretty quickly. I mean, the last I heard, they do have to apply for approval, but they're allowed to go forward with their tests. And again, I haven't heard huge concerns about the tests not being accurate. The big concern, continues to be the availability of tests, having enough tests so we can, understand how widespread this is in the community.
And David, this situation is changing by the hour, of course, so it's hard to commit to numbers, but is there any way we can say approximately how many Pennsylvanians have been tested for coronavirus?
Wait, I don't have that in front of me. I mean, I think...
Could it be the hundreds, thousands? Just trying to get a rough idea.
It was well over 100. I mean, well over 100. I mean, I was tempted to say, I mean, I haven't checked it since this morning, but I was tempted to say, at least 800. And now, though, the state, as of the last couple of days, the State Department of Health no longer has the ability to know how many tests have been given, because some of them are going to the commercial labs now. And, the labs such as UPMC's lab.
And now that there are several alternatives for testing besides the federal government, does that mean the results will be necessarily faster?
Yeah, the results are expected to be faster. I mean, I think UPMC was talking about a turnaround time of a couple hours. So it would be faster because again, up to this point, we've been, having to send results to the Department of Health. Their lab down near Philadelphia, the state lab near Philadelphia. And I think if the test came in early in the day, they might get the result back that same day. If it came in later in the day, the results weren't going to be received until sometime the next day.
So as a reporter, David, what do you think of these semi-regular updates that are emanating from the governor's office?
Well, I don't have a huge complaint about it, although now they can't. It's understandable that they can't hold them live with the reporters in the room. They were.
Oh, is that so? No, we didn't know about that, David. Tell us.
Well, they're doing them, for the last couple days. I think this will be the third day. They're doing it. They're doing it virtually. They're calling it a virtual news conference. So it still takes place over in a room at the FEMA headquarters outside Harrisburg, Susquehanna Township, but there's no reporters in the room. You can submit questions, and the questions do get answered. The problem is, though, it's hard to ask follow-ups. When they were doing them live, there were some pretty good reporters in the room, and people who knew the questions and were very persistent in their questioning. And even with that, sometimes, it was hard to find out as much. For example, it was hard to find out as much about the availability of tests and what shortage we might face regarding test kits. It was really hard to find out as much as we wanted to know when we were able to really question them live.
Understood. The reporters just don't have. Understood. The reporters just don't have the opportunity to ask aggressive follow-ups.
No, we don't. But given these circumstances, it would be. We couldn't argue. We couldn't responsibly argue that they have to assemble a gathering of reporters, which is against what they're asking everybody else to do, and what we're continually reporting that everybody should do. So just have to take it day by day. They've been putting themselves out there every day, and hopefully the questions will get answered. By the way, they also answer questions by other routes, through the course of the day. For reporters, it's never as quickly and as good as we would like.
Now, Governor Wolf is scheduled to give the public another update today at 2 o'clock. That's going to be live on PCN. Do you have any expectations as to what he'll talk about? In other words, is there any kind of pattern that's been established from previous press conferences?
Well, usually when Governor Wolf, usually when he's there, and he's been there a good many times, not all of them, but there's usually something pretty significant that that he'll talk about when he's there. I've really been focusing on the medical aspects of it, though, and just so you know, one of the things that I'm real interested in every day is what kind of community spread do they think is going on. And yesterday they did say, the Secretary of Health, Dr. Rachel Levine, said that they're pretty sure there's some community spread going on, which is a significant thing, because that means it's out there. People are getting it, and they can't necessarily, at least easily, figure out how they got it, because it's in the community. Now, yesterday, Dr. Levine did say that she's not certain that is what she calls sustained community spread, but she said that that's coming. So, so every day, personally, I'm very curious to hear what she has to say about that.
As far as alternatives for kids who are not allowed to go to school now, are there plans for remote learning? And, for example, Speaker Mike Turzai is talking about that. He doesn't want kids to take a break from education just because they can't go to school.
Well, yeah, definitely a lot of school districts are planning that. Some are surely doing it. And that's one of those things, though, when you stop to think about it, I mean, you realize there's big variations in Pennsylvania with school districts regarding what they can do, what they have the resources to do. And then, there's big variations within households, with the technology that's available in individual households, like whether there's a computer that's free for a kid, and like what if there's more than one kid, and what if the parents are working from home, and then of course broadband access. So there's just a lot of questions about how well that will actually work. I'm sure many school districts and many households can do it pretty well. But I mean, again, when you start thinking about it, it's easy to see that who you worry about the education that many kids in Pennsylvania will be able to get at times like these.
Okay, David Wenner, reporter for PennLive and the Patriot-News. Thank you very much for joining us.
Thank you, Larry.
Next, an interview with UFCW Union President Wendell Young, but first, a short break.
Focus on Aging Adults, in partnership with AARP, brings you a monthly panel discussion with topics such as prescription drug prices, holiday scams, retirement communities, and more, helping you understand issues important to seniors. Focus on Aging Adults, monthly on PCN. Visit PCNTV.com for the latest episodes and to see the upcoming schedule. PCN, proud to bring Pennsylvania to you.
Did you know you can watch all of your favorite PCN originals and more at home or on the go? Download the PCN app on your favorite device and tune in to see what makes Pennsylvania's heart beat. Watch videos on demand, see multiple live streams, and check out the free selected programs and events. PCN, Pennsylvania Politics and Policy, History and Culture, Sports, and more.
We have on the phone Wendell Young, president of the United Food and Commercial Workers Union, Local 1776. Wendell, welcome to our program.
Hey, Larry, thank you. Thanks for inviting me on today.
Effective last night at 9 p.m., all state stores closed for an indefinite time. How much of a role did you have in that decision?
Oh, Larry, I didn't have a role in that decision at all. This is something that the governor did, and I completely support what the governor did. It was necessary, important, as we've all learned more and more about this COVID-19, that it's really important to take steps like this. A lot of these state wine and spirit shops are smaller facilities that you have, especially at times like this, a lot of people, a lot of customers coming and going. It's not essential, food, pharmaceuticals, drugstores, that's essential. This is not, and there's no reason to put both our the state's employees, our members, and the community at risk by keeping them open. So I fully support what he did. He made that decision. Now, where we have been involved is in the logistics. As you know, the original call was to close the stores in Montgomery County. That within a day or so got expanded. In that time between the expansion and the original call in Montgomery County, we had some logistical issues and discussions with the PLCB folks. And, we're all trying to help each other through this. This is a time for folks to figure out how to get things done and get it done correctly and properly for everyone's mutual benefit. But that rapidly, and by the way, while we were having those conversations, we were anticipating an expansion and a statewide shutdown at some point. So that happened very quickly, very rapidly, and a lot of the conversation then became moot. We very much appreciate, look how fast the governor acted. We have Congress only just starting to deal with this now. Still, a bill hasn't come all the way through and signed from the last I looked. I haven't had a chance to watch the news today. But, this governor acted very quickly. He's made decisions on this and other things, that affect people's unemployment benefits and other assistance and aid they need. But in this case, without hesitation, agreed to pay the folks they're sending home. Our employees, for us, it's 3,500 people. For the agency, it's over 4,000 people affected. And that's huge. And that's really what this comes down to. We had not just this agency, but state government, a major employer shut down. And it's very important for them and their families, but also the economy of the state, that they continue to be compensated through this. In the private sector, we have lots of members that work in grocery stores, drug stores, food processing facilities, nursing homes, and other places that are on the job every day now. But most of those employers have agreed to do the same if time comes to close all or part of a facility. We're in talks with the others that haven't quite gotten to that decision yet. I think a lot of folks are hoping it doesn't come to that, but the reality is, it might, and we have to be prepared for it. So I have to say that, the governor actually saved people a lot of grief by making not only a good call, but doing it the right way. And I hope it stands as an example for many others in both the public and private sector around this country in the days and weeks ahead.
Wendell, I want to make sure I understand. Are your state store members continuing to be paid even though they're not working?
Absolutely.
But how long can they still be paid with the stores being closed indefinitely without business coming through the doors? How long can that go on?
This is an unprecedented time we're in, and no one's addressed. I don't know anybody in both the private and public sector that knows for sure how long this is going to last. Obviously, we're all hopeful it'll be shorter than longer. And all I can tell you is that for now, that's the position that the governor has taken, and we support, and we're going to continue to support it. We'll reevaluate with them over time, but we're also, all of us are waiting to see what the final package of relief looks like coming out of Washington, and who that will or won't help. And then I think the state government's going to be challenged, the legislature, to do something as well. So there's other pieces that are going to need to be answered before anybody can say that. I will say that the Wine and Spirit Shops is extremely strong financially, and so is our state government in terms of recent budget status and projections. But none of this is good for anybody in the public or private sector. But what's not good is if you shut down a part of a state, a whole state, or a nation, and also not pay people. They won't be able to pay their mortgages. You create a ripple effect that's very damaging to the economy. So while it may be difficult to have arrangements like this, the consequences of not doing it are far worse for our economy. The negative multiplier effect that will run through our economy and ultimate run on the banks would be devastating. And we've never seen anything like this in any of our lifetimes. I've said to some people recently, I'm old enough now in my late 50s to remember my great-grandparents, my grandparents, and older aunts and uncles talking about what life was like during World War II. And this reminds me of those stories. And let's hope this gets better faster. But I think we're in for a little worse before it gets better.
So, Wendell, what can your local do to help your members cope that are out of work right now?
So right now, as I said, the good thing is they are being paid. So they know they can pay their bills, get food, get their prescriptions, their benefits continue in place so they can take care of their families, whether related to COVID-19 or other health care issues that are ongoing or occur. In terms of resources, we're all looking at the same resources that are coming out from whether it's, and again, I have to compliment Pennsylvania. The governor's administration did a great job at putting resources online. We've copied a lot of those and put them on our own website. We've been pushing out email blasts, robocalls, and text messaging blasts to our members, providing a lot of the same information as well as directing them to where those resources are. We've
Would this be the COVID-19 Resource Center, Wendell? Is that what you're talking about?
Yes. And we've created one of our own, which is really just borrowing from state, local, federal governments and other credible sources to help our members through this. Right now people might be panicking about, well, what do I do about one thing or another thing? So we're trying to have that comprehensive resource, and we don't think we should duplicate, so we're going to the official sources and just compiling them so people can find them in one place or direct them with links. And we've been doing a lot of digital messaging to get that out to our members, as well as our reps in the field, our shop stewards in the field can copy this material and distribute it at work where the facilities are still open. All
right, that's all the time we have. Wendell Young, President of the United Food and Commercial Workers Union, Local 1776. Thank you for joining us.
Thanks, Larry. Take care. Bye-bye.
Next, an interview with Senator Maria Collett, but first, a short break.
The eyes of the nation are on Pennsylvania as a key influencer to the 2020 election. PCN has over 25 years of trusted state government coverage. Our network is your platform to connect directly with Pennsylvania voters. Whether it's a presidential race, statewide campaign, or local cause, our viewers are ready to hear from you. Book your ad now. PCN, your access to Pennsylvania voters.
PCN brings the distinct aspects of Pennsylvania and its residents to your favorite screen. Hear from state government and community leaders during unedited, balanced coverage of politics and policy.
Dig into the rich history and culture of the state, presented by notable residents and historians.
Score a view of the best high school, college, and world-class athletes competing across the state, and much, much more.
Start exploring the Keystone State today on PCN and the PCN.
We have on the phone with us Senator Maria Collett, Democrat from Montgomery and Bucks counties and minority chair of the Aging and Youth Committee. Welcome to our program, Senator.
Thanks for having me, Larry.
Montgomery County is considered the epicenter of coronavirus here in Pennsylvania, so try to give us a feel for how things are there.
Sure. So I have to say that first and foremost, I give a lot of kudos to our county officials. Things here have been changing incredibly rapidly, and it's been something that we've really had to stay on top of. First, when we were just sort of following which cases it was that were coming to light, and then secondly, when we started to implement these mitigation standards and what that meant for folks that were going to senior centers or kids that were going to school. We closed our schools before the statewide closure of schools. So that was something we had to really get our arms around and figure out what we were doing here in the county first before it went statewide. Having the state support is even better. But initially, when it was just the county, we were really struggling to navigate all of the facets of this and really figure out what it was going to mean for day-to-day life for Montgomery County residents.
Now, a minute ago, you mentioned mitigation standards. That sounds like something official. What do you mean?
Yeah, so our Department of Health, before we were at a containment level where we were just sort of looking at everything, keeping track of the cases and doing the contact tracing, as the Department of Health calls it, where we figure out who these people that are testing positive or suspected to test positive, who they've come in contact with. And recently, our Department of Health at the state level has moved to a mitigation level where we are trying to keep the spread of the virus from continuing. And that's been keeping kids home from schools, trying to close all non-essential businesses so that people are not out in the community interacting more than they have to be.
So how's your district office handling interactions with constituents?
Well, I am glad you asked because our district offices are ready to help these constituents. We have not shut down. My employees are working from home, but we are checking our voicemail messages every hour to make sure that we're getting back to people quickly. We are answering through emails. We're calling people back. We are following up on every lead that we can to make sure that our constituent services are just as robust as they were when everyone was in the office. And I have to say that since we've been working from home this week, our constituent services are working harder than ever, making sure that people have the resources they need and the information they need, because this is a time when the more information you have, the better equipped you are to make good decisions about what it's going to take to keep everyone safe. That's you, your neighbors, your family, everyone.
Now, I understand you're a lawmaker and a nurse. Is that right?
That's absolutely right.
So
yes,
that would indicate to me
nurse.
you have a lot on your mind. So how is the nurse side of you responding to the coronavirus outbreak?
Well, I have to tell you, I used to work in a long-term care facility as an infection control nurse. So getting a handle around infectious disease is something that, I really feel like I'm confident in. And I am really happy to hear the reports that are coming from the PA Department of Health, from our Montgomery County officials who are telling us, hey, this is what it's going to take to make sure that we're keeping people safe. Listen, I've been a hand washer, from day one, but
right.
Now it really does resonate when I tell people, make sure you're washing your hands, sing happy birthday twice, cough and sneeze into your elbow, don't touch your face, and try to avoid contact with people as much as possible. That's all ringing really true here, and I feel really good about our efforts here in Montgomery County to stop the spread of this coronavirus.
So take off your nurse cap for a moment and put on your legislative cap and think like a lawmaker. How does being a nurse inform your priorities as a lawmaker during this crisis?
Well, it's a really big impact because it lets me understand what it's going to take legislatively to make sure that we are implementing the medical and health standards that we need. For example, calling on our governor and asking our governor to make sure that we are having a statewide closure of schools so that, it's not good enough. Viruses, as you know, do not stop at county lines, right? They don't know geography. They go where they go. And we have to make sure that our governor has a really strong message to our schools, to our non-essential businesses, to people that are out and about in the community, that, hey, this is the time to really be mindful of that social distancing, to really make sure you're washing hands, to really do everything that you can to limit your interactions with people out in the community. And I am really happy to say that my caucus, the Democratic caucus in the Senate, has made a significant effort to keep our communication open with Governor Wolf and his administration and Secretary Levine, so that we understand all of the instructions that are coming down and how we can relay them to the people in our districts. We have all signed on to a letter that went to the Pennsylvania Supreme Court asking for a statewide judicial order to postpone evictions until after this pandemic has passed. We think that's critical, too, making sure that people have the security so that they can stay home from work if they need to, because there's nothing scarier than knowing that you can't go to work, but that if you don't go to work, you may lose your job and your livelihood and find yourself in an even worse position.
Now, normally House sessions involve hundreds of people, as you know, of course. What adjustment has been made to your procedure at the Capitol?
So we did not have session on Monday and Tuesday this week as scheduled, but today we do have session and a quorum has been activated there. We do have enough people to make some decisions, and the biggest decision that we're making there in the legislature today is a rule change to allow for us, those of us that are in district, to be able to continue to vote and participate in the legislative process. But above and beyond that, what we have really focused on is not just doing business as usual. We're not going to stay in our districts and vote remotely on, just regular measures. What we're trying to do is bring forward and implement the things that are going to provide relief to small business owners, relief to working people, relief to our school districts, to make sure that they have all of the resources they need to continue to ensure the safety of the people in our communities. So those are the kinds of things that we have really been pushing for to see on the virtual floor of the Senate as we go forward and vote remotely to make sure that our Capitol isn't overrun by people and infection as well.
Senator, I said you were in the House, and of course you're in the Senate. I apologize for that mistake.
That's all right.
Let's talk about any other legislative matters that our Senate should address immediately to avoid any more economic ramifications.
I think the biggest thing is relief to our small business owners. We've got to figure out a way, aside from what the federal government is doing, and we have our fingers crossed that the federal government is going to implement a stimulus that's really going to make sure that we're helping small business owners, a package that's going to make sure that they don't suffer. But at the state level, we must do the same thing. We must make sure that we have relief to small business owners because they employ so many of our Pennsylvanians. And let's face it, a lot of those small businesses are the places where people don't have access to sick leave or paid medical leave, where they don't have, a huge operating budget so that they have the ability to send workers home for a week or two without any sustained, financial impact. Those businesses are the backbone of our economy here in the United States and especially here in our Commonwealth. We must do everything we can to protect them so that they, in turn, can protect their workers and our community. It is truly the biggest thing on our minds when we have our daily calls with our caucus where we all sit down and decide what we need to push forward as legislation. And I believe it is essential that our legislature take up these measures, move them, enact them so that we can start getting relief to business owners and to people in the community and make sure that that relief is really going into the pockets of employees and employers so that they can do the right thing.
Last question, Senator. Given your experience with infectious disease, any advice for restless families who are trying to pass the time in a crowded house?
Well, I will tell you, we're a crowded house here, too. I have a 7-year-old who's home from school. My 84-year-old dad lives with me. And, of course, my husband and I are both here as well, working from home as much as we can. And I will tell you, what we've been trying to do is find lessons in daily activities. Yesterday, my son and I baked some St. Patrick's Day cupcakes from scratch, and we used chemistry to figure out how to make our own buttermilk and figure out how to make our own cake flour because we didn't have those things available in the cupboard. So I looked up some recipes online, and we implemented those, did measuring, math to make sure that our quantities were appropriate for our baking. And every day we're trying to look for some little lessons in the activities that we do. The other thing I can tell you is it is okay to go out and get exercise, take a walk, breathe in some fresh air, practice your social distancing while you're out. But certainly keep your bodies active, keep your minds active. It is going to be the best thing when we all come through this on the end, that we are as healthy as possible.
All right, Senator Maria Collett, that's all the time we have. Thanks very much for joining us.
Thanks, Larry. Have a great day.
That's it for Coronavirus Impact. Visit PCNTV.com to find out the next time this program airs. I'm Larry Casper. Thanks for watching.